Yes, with that, I think we'll begin. Thank you for joining this webinar, where we will introduce our webinar series and our approach to how to learn spatial-temporal modeling of climate-sensitive disease, uh, where we will show a lot of, where we'll have a focus in the webinar series to come on use cases and modeling infrastructure based on the DHIS2 ecosystem. We'll show a bit about how this will be done today. I will just give a very brief glimpse through the kind of entire topic of the webinar series, and then we will dive more into details in the next webinars to come. So this is more of an overview lecture to introduce the whole webinar series and to introduce the whole topic. This webinar series is also connected to a physical workshop that will be in Kigali in late February, where some of you will be part. But we have put up the webinar series so that it should be relevant for anyone joining the webinar series, so that you will be learning and you will get concretely started by joining this webinar series. So this webinar series and the workshop is organized in a collaboration between DHIS2, Climate and Health Project, part of the HISP Center in Oslo, where I'm also associated, Ministry of Health in Rwanda, HISP Rwanda, the Climate Sensitive Infectious Disease Network, CSID Net, which is a global network led from Nairobi, the Data Lab for Social Good, from Cardiff University, and also a Norwegian AI Center Trust. So what we'll do in this webinar series is to look into several topics. We will start by introducing what is time series modeling. I believe many of you already know, but so I will just give it like a very quick glimpse. And if you don't know it from before, you will now get a very basic overview, and then we will dive more into it with a full webinar session and some follow-up in later weeks. So what is time series modeling and what is spatiotemporal modeling? Then we will continue with a little bit of some statistical underpinnings of the modeling approaches. So what is like Bayesian hierarchical models and so on. I will just give the glimpse for now. Understanding how to set up appropriate evaluations and choose metrics. I will just again mention what it is today, and then we will have dive much more into detail later in the webinar. Then we will also introduce climate-sensitive heat health impacts, including infectious disease as one important health impact that is affected by climate, and also how to approach climate-sensitive disease or health impacts through modeling and early warning systems. Then a major focus on our webinar series, and what maybe puts us a bit apart from other webinar series, is that we will spend quite some effort and already starting to give a glimpse today about how you could set up an effective software setup so that you can yourself develop models, use models, get the data in, and so on. So that will actually be a major emphasis today. And then I will also share some reflections in the end about understanding the full picture of spatial-temporal modeling when you want to kind of consider an operational context, when you want to support some real-world decisions and have an impact. So I will just, the order I will go through this is that I will start by going very quickly through climate and health, then spatial-temporal modeling, then how you can concretely work on that, having my reflections on impact and decision support, and then round off with some further information on what will come in the rest of the webinar series. So the setting in which we work will be spatial-temporal modeling of climate-sensitive health impacts. And WHO has stated that climate change is the single biggest health threat. And the reason for that is that climate change is affecting almost any health impact. It can be directly heat-related illness. It can interact with heat to respiratory illness. You have a lot of things related to waterborne diseases with flooding and different rainfall. of course, you have zoonosis, you have vector-borne disease like malaria and dengue that I will give some examples of, malnutrition, and you also have non-communicable disease and mental health. And this is the vulnerability is affected again in many different ways. The vector-borne diseases are affected by, for instance, mosquitoes having different temperatures and different access to surface water. So it affects the mosquitoes, but also the biting behavior, and also their social, there's a social, the human behavior. And that goes for many of these, that is both the direct effects and is how it affects the society. So it's a lot of different exposure pathways. It also affects the health system capacity and resilience, and it affects different peoples in different ways. We will have a full seminar series later on this topic, so this is just a brief introduction. Also, since we are now focused a bit on data science and modeling and so on, I would also point out that the climate crisis is also a kind of information crisis. It leads to a reduction of the predictability which affects our societies. So it's not just like the conditions that are less suitable with like drought or flooding in many regions. And it's not just that it's different before, maybe where there were fishing communities, water is drying out, or where there were houses close to the sea, is sea rise issues. But it's also a challenge of predictability in itself, because if you have a very stable climate, the seasonal patterns are quite routine. You can relate to knowledge of how often and at what timings and at what severity various health impacts like disease outbreaks would occur. But now, since the climate is changing, we get new weather patterns, new climate patterns uh, that challenges the established routine health sector functioning and puts requirements to have a more dynamic and adaptive health sector response. And that is very difficult because you need to move from kind of relating to historical statistics or built up knowledge of what happens to trying to model or predict or forecast what will happen in the future. And that is always a much harder problem to be able to anticipate what health impacts will occur when you don't have kind of a stable historic pattern to base it on. So I mentioned briefly about malaria. So to give that as one example, malaria now spreads to new countries. It spreads to higher altitudes because of higher heat globally. This leads to altered behavior of the mosquitoes. They reproduce faster, they bite more frequently, they carry disease more often. They spread other months of the year. And also the increased heat might lead to migration, to more time outdoors, harder to use bed nets, with all of these human factors also relating to the spread. So if you now want to anticipate malaria and respond a bit proactively to malaria, we have to try to model this. And this is why data science and modeling is now really entering disease handling for many diseases. So the next question is, one thing is to anticipate and forecast and predict, but why do we want to do it? What is the use of it? And if we have a good warning of an upcoming epidemic, it can make it easier to limit or manage, especially if you have a good horizon, if you know it in a good time in advance, where one could have more targeted vaccination for some health impacts. One could have bed nets, use of insect repellent. One could prepare the healthcare system for an incoming epidemic, make sure to stock up on required medicines and so on. And one can have campaigns on particular caution in periods when one expects this to be particularly challenging. One can also have it as a very long term. If one understands the underlying connections and anticipates regions that will have a lot, one can, for instance, have measures like removing puddles, urban planning to make sure that one, for instance, in this case, reduces standing surface water. So that was the climate health side of it. Now, what about the spatiotemporal modeling, which is the methodology we will be applying in this webinar series? So this is a very generic figure of what is time series, not connected to climate yet. Um, what we have is that we have data back in time. And the reason we call it time series data is that we have something that we have measured or observed at different time points that is a bit continuous in time. So this could, for instance, now be malaria cases, malaria incidents in a given region, for instance. And based on these observations, we do model fitting. So we can try to learn how this will project, and or we will try to learn kind of the underlying trends in this data. And we want to now forecast how it will behave ahead. And this is now based on it's a bit of, you can see it's always a bit, or typically a bit smooth. When there is a lot of malaria, there will often be a lot of malaria in the next period. It's also often seasonal, that's what certain seasons are. And in our case, it's also affected by other factors like rain and temperature that comes in as a kind of a separate time series actually from this one and influence what happens ahead. When we do this, and now moving over to malaria as our more focused case, we have observed this for different periods in the past. For instance, the number of malaria cases in a given region. And we are asking ourselves, what do we now believe will happen ahead? And there seems to be a trend here, so maybe the model believes this trend will continue upward, but you cannot know it exactly for sure. There's so many elements that will affect this, and just giving like a single prediction like we did here, so to have just like this is what we believe to be as a single number is often not so useful. So what we typically want to do in time series modeling is to maybe give our best guess, or the model will give its best guess, but we will also show the uncertainty. And that you can do in different ways. What we have here said, it's like, well, we believe it's a 50% chance it will be within this range of the kind of light blue, and a further 20% chance in the even lighter blue. So basically covering 50% inside here and a total of 90% in the full range. So something like this is what the models typically will want to say, meaning that anybody that uses this model will now see the full range and see that it's uncertain and try to anticipate that even though it's low, there could be a slight chance that it's much higher or vice versa. What we then do as modelers is that if we have now some predictions we made, we can wait and we can see what happened. And then you get the real observations and we can compare what we anticipated to happen back in time with the data we have point. And we can later compare that by putting in what really happened in this time point and see how close we were. And this, of course, we have to do across many regions, time points, and we'll come back to that. So now I've talked about time series modeling, and this webinar series is about spatiotemporal modeling. So what does this spatial mean? Well, it means that we do not only have one time series, but one time series for many regions. So one could imagine something similar to what I showed now for malaria, for different regions, for different districts, different provinces in a country. We want to predict all these time series. They develop across time, and we also believe they are a bit similar across regions, especially across neighboring regions. For infectious disease, this is quite intuitive. It is that if you have a lot of an infectious disease in one region, you expect that it would be infection going to the neighboring regions due to human mobility, or it could be also, for instance, mosquito mobility if it's a disease like malaria. Again, we could be interested actually in, and for this reason, since we are kind of having many regions, we sometimes show it as many time series, but we also sometimes show it as a map. So this is, for instance, a map of Vietnam, where you can see the disease burden in January, February, March, April for different regions. And now you can see like instead of seeing it as kind of a behavior ahead in time and a curve in time, you now in a way see at a given time point where in the country do we believe there will be a lot of disease cases, in this case, dengue. And one can often see that this is often a bit kind of smooth again, that some parts of the country will have low and other parts will typically have high. Just quickly check if anything. Yeah, I'll come back to the chat actually afterwards. It's very nice if you post questions in the chat. There might be someone in our team that is able to respond on the way, and if not, I will also come back to this chat as we go. So we could be interested in kind of now if we have unobserved values for a given region, we come to say like we lack the data in one region. Let's try to estimate based on neighboring regions. What we will focus on is instead the early warning setting, where we want to be in a given region and provide an early warning about an potentially upcoming epidemic in that region. So we do it per region. The way this modeling is typically happening now, still just like skimming the surface, is that essentially you have the data on climate, you have the data on health, like dengue, malaria. Then there is a model that connects the kind of a mathematical formula that we learn through machine learning, statistical models, that connects past values of disease and maybe climatic data over to our predicted future time points. And we learn that across time. This is just one example, a Bayesian generalized linear mixed model that will be introduced later in the seminar series, but we will also show others. And you can see that this is kind of, again, this is a mean value for what we believe will be the disease cases the next month, which is again affected by things like population at risk, previous dengue cases, different climate covariates coming in, land cover covariates coming in, and so on. One thing one can also note here is that the way these formulas operate is often that it's something like climate covariates, which could be now rain and temperature, is kind of just like an X in the model. It is kind of a covariate variable, and it's no special treatment of temperature versus rain. It is just kind of a value coming in, and it's the model that learns how to treat temperature and rain and learns their specific relations over to disease cases. If we take one step back, there are like a lot of different ways to kind of mathematically formulate this. But essentially, what we want to do is something like malaria cases in April, based on malaria cases in March, February, January, but also the rain and temperature and a lot of other variables that could influence malaria in the past. Maybe we also have rain and temperature in this current month, like a weather forecast, maybe even a seasonal forecast going ahead. But this is essentially the setup. And a lot of data could be put in here. And I think like from the data science side, the challenge is partly to find the right mathematical formula, but it's also to find the right variables to use. And we will have separate sessions, both on the mathematical formulas to use, how to evaluate it, and a specific session on how to find the relevant data and harmonize the relevant data. So over to data science, epidemiology, and statistics, which is the main focus of this webinar series. And I had a lecture once that said that working with data science or machine learning or statistics is kind of 10% inspiration, 90% perspiration, and 20% desperation. And I think we hear also this is kind of pointing to maybe the first rule of statistics, that something can feel like more than 100%. And that is sometimes how data science is. So what do I mean with these kind of things? Well, part of our work is inspiration. It is an open challenge we have. It is a question we are curious about. It is a use case of a malaria prediction, of cholera outbreaks, of the health impacts of air quality. And it's maybe an unmet need. It is kind of efforts towards malaria eradication or preparation for the health system. And maybe we also have now a methodological idea for how we can improve the solutions. We have some machine learning method we want to use. We have some data set that we think can inform this. So that is kind of the inspiration part, and often we feel that this should be 100% of what we do, but then comes the perspiration in. And what is that? Well, and perspiration is a fancy word for sweating. So that is kind of like all the fiddling and all the work that ends up that you hadn't thought of when you kind of had the main idea and the vision, but that is really the crux of data science. It is getting access to the data. It is harmonizing the data representations, different formats, different regions for the data, different, some are in weeks, some are in months, all of those kind of things. And then afterwards, in order to do it, one has to install libraries, set up evaluation workflows, all of this just to be able to kind of going back and kind of follow up on the main inspiration and vision one had. And in the end, there's this 20% aspiration, which is this additional 20% or maybe 200% and that one didn't plan for. It's everything that does not work as planned. Everything that turns out to be much more difficult than one thought initially. So our response to this, our approach to this is because I have been working on data science now for 20 years and have been having these kind of feelings too often. So the approach we have we are using for this webinar series and that we want to share with you is an approach where we employ a bit more sophisticated technology upfront. So it will be a bit more advanced to get started, maybe with our approach compared to just starting with a blank setup and started writing some code somewhere. But the reason we do that is we want to reduce this amount of sweating or perspiration that comes up. So it's kind of investing a bit of time upfront before getting started to learn some powerful technologies and to learn a streamlined process. And with that in place, one then can have that as an alternative to instead of like constantly facing small wrinkles and small hiccups along the way. So we kind of do something a bit more sophisticated and advanced maybe, but we really try to have, we really spend a lot of effort trying to make it as easy as possible, but to have a bit of a sophisticated technology and process so that it can kind of so that when you get started and start working, it can be very smooth. And we have tried that now out for a year with different collaborators. And our impression is indeed that like by having this initial additional setup, it can be much smoother. So one way of seeing it is that you have your kind of, you will have your brain sweating instead of your fingers. You will kind of have to learn more. You spend more efforts learning about good technologies and processes. And then you spend less time kind of fiddling around with correcting small issues in this that I showed in the last slide. And I will be a bit more concrete on what this means. So one way we approach this is by providing some broad frameworks and inviting the whole community to join the development of open source frameworks that can have standardized and reused functionality. So the standard data science pipeline for climate health modeling or any kind of spatial-temporal modeling is to typically start with, for instance, some climate data in this case and some health data. These have to be harmonized, can take quite a bit of time. You have to have like temperature data for the same regions for which you have health data. Then you have that, and it's typically in the end, it ends up as a simple text file, a CSV file or something. I'll show that later. That goes into some kind of model that does the training, that predicts ahead, which again produces a CSV file that goes into, again, some kind of functionality that does the evaluation of how good the predictions were. It can be visual or it can be computational metrics. If starting from scratch, one can again spend a lot of time on the harmonization of data, on every kind of issue with the data, of getting it aligned and working with the model, and also spending a lot of time getting this evaluation correct, and maybe being a bit misguided in the beginning if the evaluation was not set up appropriately. So what we have tried to do here is to make some quite robust and mature tools that can streamline this entire process, so that we have something called the climate app and the climate tools that will be introduced later in the webinar series that gets the data in, harmonizes the data so that you have the data, you have a temperature data for the same regions and the same kind of entities as for which you have health data, like dengue or malaria. This can now be often collected in what is called a DHIS2 system and a DHIS2 instance. We will introduce that more later in the series. DHIS2 is an open source system that is the system that is actually used in more than 70 countries are using this at the national scale, including most countries in Africa and many in Southeast Asia. Since this is a standardized system, a lot of protocols has been standardized. It means that kind of data, there are processes for data cleaning, for being clear about what regions the data represent. And with the climate app and climate tools, we can now harmonize it to DHIS2. And based on that, we can get down CSV files that are in the same simple format as one would have in a kind of more ad hoc pipeline, but where essentially these mature tools can take away all the sweating and perspiration and effort of doing this from scratch. And part of this webinar series, and especially the physical workshop, is that we want to also connect modelers, for instance, modelers at academic institutions, to ideally to ministries, organizations in the country, where there exists data and use cases, knowing about the data and how these can be trained. And the HISP groups and the HISP network, which is operating in many countries, and that will be introduced more later, they are that they can also play a part in this connection, and are working currently hard to connect between different organizations, groups, to get everybody together on the kind of the same, to all pull in the same direction. And then we can have harmonized data for many different diseases or health impacts going in, and one can sit and develop models doing the prediction of these. Instead of developing one's own rigorous evaluation, we also have a rigorous evaluation pre-made, even in a GUI that one can use oneself, or one can have it in collaboration with more of a domain expert, disease domain expert. This is how we show it. We will not go into this today, but this is kind of the overall system of the DHIS2 ecosystem, where climate data can be local or global sources, come into this DHIS2 system, where there are a lot of apps already existing. There's a robust database. There's something called climate tools that can also move all this over to a modeling platform that I will introduce, and a modeling app. So that is like all the kind of big picture. And then I'll try to start diving into the small details and show you some live demos. And some of you might have heard this, it's sometimes referred to as the first rule of data of computer science is to never do a live demo. I will try to do a lot of live demos now, so we will see how it works. And I will do it according to this Hello World tradition. So many of you have maybe seen this, made your own Hello World program when you learned a new programming language. To the right there is actually the Hello World signed by Brian Kerringham in 1978, so a long time ago, which was his way of showing what you can do with a C language, which is one of the first programming languages. So this is a tradition that has gone on, and we will kind of follow an approach that is very similar to that. So what we will do is to start with an absurdly simplistic spatiotemporal model, in line with just printing hello world to the screen, right? It's very simple. It's not meaningful in any way, but we will make sure that this can run on one's machine, on a laptop server. That will actually be the first 2 sessions of the webinar series to get all of this up and running, where it's also connected to standardized data sources, so that when it's up and running, you can run on data from many different countries just out of the box. That it's out of the box also rigorously evaluated. So you have a very bad model that you start from, but it's very rigorously evaluated, so you can see how it works. And that it's also already from the start and out of the box connected to a graphical user interface, so that like if you later want to actually disseminate that and have some domain experts or ministries or disease programs use it, it is already ready for showtime, kind of. So kind of you have everything around it working, which is the same of this print hello world. It's like in that case, it was kind of compilers and linkers and all of these kind of things to kind of make that program code run on a machine. We are kind of doing the same thing here. Very simple model, but make it work in a kind of a sophisticated setup, and then you can start making the model gradually better. So we will set up this and learn all the technologies about how to do it with version control, virtual environments, installation in the first two webinars, and then we'll continue with how to make a good model and choose good data sources in the remaining webinar sessions. So we will base it a bit on this material, which is at this link that is also available and from the slides and is available on the web pages. This is open source material on how to learn statistical machine learning model according to this webinar series. It's also material under development, so it will be improved as we go. What you will soon, if you look into this, you will very soon come to this part, which is making your first model and getting it into CHAP. We have now a minimalist example in Python and in R, so that if you're a Python coder or R coder, you can choose what is best for you. I will now in my demos show Python, but it works in the same way with R. When you follow that link, so the minimalist example in Python or R, you get to a page like this, which is the minimalist example of model integration with CHAP. So let me see. So here you can read up a bit on the background. We also have a gentle introduction to machine learning models and the terminology if you want that. A bit about the motivation, why we do it the way we do. And then you come quite quickly to this minimalist example. This minimalist example is now a repository in GitHub. And we will in the first webinar show how you can now take a repository like that has a little bit of a few code files, and how you can now make what is called a fork of it, so that you can have of your own version of it that you can work on your computer and share back to the world. So what I will do for now is just give you a glimpse. Now I have downloaded this, or what is called cloned it, and I have the files here locally. So what this minimalist example does is that it has some files where it trains the model. So if we look back at what I talked about previously, this is all the historic data for dengue and rain and temperature that we have available in some kind of training data file. And then we later want to predict with this on what we believe will happen ahead. In this, when you download this one, it's actually, and we will go more into the detail in this in the second webinar, but it's very trivial. It is kind of, this is just like the example data to start from. It is kind of two pretended location, one pretended location even, with the date like May and the June 2023. And then this is kind of the rainfall, 10 millimeters, 30 degrees, and 200 disease cases. So it's a very, very, very simple file, but it's just to get you started. And in this, we can now train a model and predict. Again, how we train and predict is in this template, extremely simple. So we have a function called train, and it takes in a CSV file name and a model file name. So this is something that we assume that you are a bit acquainted with, either in R or Python, is to define your functions. This takes in the CSV file name, which has the data. It reads it in this case in pandas. You can do it however you want. We use this pandas library. Extract some features like rainfall and temperature. Say that this is like X, like we typically, the typical terminology. The Y is kind of the disease cases. We fill some zeros. And then we say, let's just learn a linear regression. And the linear regression is kind of the simplest statistical model we have from X to Y. So from the rainfall and temperature at the given month over to how many disease cases there are. So this is also where you see that this is absurdly simple for many reasons. We are not looking at disease cases back in time for now, only the rain and the temperature. We are only using a linear regression as if kind of the higher temperature, the more disease. It would probably be a much more complex relation. But anyway, we can train this model. It's called fit, and we can dump it to file, which is what we got in here. So then afterwards, we have a predict function, which is again similarly simple. It takes in this file name where we put in the trained model, where we have trained it on the relations, and also some historic data and future data. And then we essentially just load this from the disk again from this file name. We make the predictions. We put it in to a data frame because I here use pandas. You can use other things, and we write it out to a CSV file, which is this predictions file name. So basically what I'm doing now is just to kind of, based on this absurdly simple data set, I'm learning an absurdly simple linear regression that connects these rainfall and temperature values over to disease. And then I afterwards try to predict ahead in time based on these. But the nice thing is that we can already run it. So I can run this isolated run, and it trains the model, learns some coefficients from rain and temperature in this kind of made up data set, and it makes the predictions for the 3 months ahead. So it kind of sets that in the next month it will be 325, and then for 450, and then 450, for instance. So this is kind of the hello world, right? Now I have a system that works in this very simplistic setting. And I can also quite easily change to something else. I could say that, well, let me start by the linear regression. Let me do something a bit more advanced maybe. So instead of the linear model, I can say I want to have an ensemble model where you have the random forest regressor, and I use that one instead. Now I have a new model. It's not a linear regression anymore. It's a random forest. I can again run this one, and it makes some, yeah, I just have to, I was printing something that I have to remove. And then it makes some new predictions, and you see it's different numbers from last time. The random forest works a bit differently, but in either case, this is not very meaningful because it's not using the right data. It has to look at disease back in time and do things more sophisticated than this, of course. But at least it shows how you can easily get started, and then you can improve what kind of data you give to the model, and you can go through many iterations of improving this. What I've now done is to have the train method and predict method. These are the functions I showed in Python and that we have in R. They have some input parameters coming into them, like the data for training, and the model is being sent further to predict, where it also gets in historic data. And then I was directly running this from my local CSV files, and I was manually inspecting this forecast. So what I mean with this is that I was defining this train as taking in some file names, opening up these files, and sending something out. And the predict one was similarly sending it out to some predictions file name. Then I do a very slight thing more. I also say that there are two, I just define this a bit formally to say that there are two ways to running my script. This comes with a template. So just telling me that to train, it needs the data and where to store the model. And this is kind of the command. It's running Python on this train.py, which is my file here. And for prediction, I have something similar with parameters, the historic, the future data. For instance, this is where I will put in my predictions, and this is how it's running it. So all this comes with a template, so I didn't have to do anything actually. And it ran with these isolated files, this kind of absurd 2-line file. But the point of this integration and why I talked about hello world and our approach to this is that by having done this, my system is now ready to run through a more sophisticated architecture that we call CHAP. So this will be introduced in the second week of the webinar. So what CHAP does is that it has rigorous ways of doing evaluation. It has rigorous ways of harmonizing, getting in data, harmonizing data. It operates out of the box together with this DHIS2 system. It is connected with the GUI and all of that. And the point is that where I was now kind of loading data from a CSV file in just this small, simple code base, the CHAP system will use kind of this exact same parameters and the same functions to do a much more kind of sophisticated run. And you don't have to think about this. So as long as it works the way I did it now, it will automatically work in this larger integrated system. And you get everything that the CHAP codebase has, you get as a bonus for free. So what does that mean? Well, it means that I can install CHAP and then I could actually show how we install CHAP. Um, Then we have, if you follow the documentation, you will also get to a small guide for how to install CHAP. We will go back to this in webinar 2. So when I've done that, I can actually again go to my minimalist example, which tells me that after I have looked at this training data that we did, the training code, made these predictions, and set up this small definition of how it works, I can just run this line on the command line after installing CHAP. CHAP evaluate with the model name, the dataset name, in this case Brazil, and then CHAP has already data for some public datasets as part of it, like Brazil data, and it has functionality for evaluation. So I can run that, and it will now run the same code that I had with a random forest, run it many, many times for many different regions in Brazil, for many different time points. It's getting the data back, it's doing the evaluation, and it's giving me very soon a simple PDF file. See, it's a lot of things happening here. And it's now saved to a simple CSV file, PDF file, where you can see these predictions. And as I said, this was an absurdly simplistic model. You see the blue is what it predicts, and the orange is the reality. So I think like when you are here in 2017, 2017, it's not a good model when it suddenly predicts this, right? And it's various reason for that, and it's simplicity. I will actually show one thing more. So the next step of this, I said it was connected to a GUI. So the next step of that is that in the DHIS2 system, so this is a DHIS2 system that the ministries in now 70 plus countries are using. And also a lot of disease programs have specific DHIS2 instances installed. Here we have the modeling app, which connects all the health data in a DHIS2 system to a model. And any model that you have now made, the only thing you need to do is to take this URL, github.com minimalist example. If you make your own example, the only thing you have to do is to give this URL to someone that have a DHIS2 instance, and they can get your model as part of this. Then what they can do is that they can set up some evaluation, just call it demo for now, to say that I want to, for instance, have some weekly from maybe week 1 of 2016. I don't trust my older data maybe. And anybody can do that has this large database of health data to maybe week, again, 1 of 2023. I select where in the country I want to use it, maybe some first regions. This is in Laos. I select the model, and you see here, your model would turn up here. We have different early warnings models. This is one from WHO, so I'm selecting that one now. And this model, you can again say, okay, it is a model that can predict disease cases. It's up to me to decide what disease cases to have. I'm taking dengue. Population is already inside this system. The climate data is already harmonized. These are from global sources, but many countries also have them from local sources. And here we have the air temperature, for instance. And I can check that this works. Everything seems to work, and I can start to run this. And now you see this is running on the server in the background. And after it's been running for a few minutes, I will get it up here, which is now, again, similar to what you showed. The blue are the predictions from this model. The orange is what happened. So the model was looking at all the data behind here, the climatic data and the dengue data, and trying to make the prediction. It's a much more realistic. It's a real model developed by WHO. And you see, you can kind of be at different time points for this. You can look at different regions. How well is it hitting in different regions? And you can also go down and, for instance, do various evaluations here. All of this can actually be contributed by you in the community to see various aspects, various metrics for how well it works. All of this we will come back to later in the webinar series. So now you've seen a bit of like the background, climate health, the background of spatial-temporal modeling, how to kind of do it concretely. And all of these three things we will go much more in detail into in the remaining part of the webinar series, where there will be focused sessions on each of these. Also just wanted to mention one thing now at the end about how we kind of see this and how we think one can succeed and have impact. One thing that we have seen is that most research is focused on how to go from a disease over to the models, which is what I focused on now, and what is the main focus also of this webinar series. But we want to emphasize that, like, okay, often this is only running in developers' laptops. It's often hard to install. I think by the approach we're taking this webinar series, we hope it will be more easy to install and use. But also, we want to emphasize that it's very important to go from the models to like the real decision support, the real how will it be implemented by disease program? What decisions will it inform? And what are the needs of these decision makers? So in the webinar series, we will focus here in this physical workshop in Kigali that I mentioned. We will also have a lot more focus here. And also in the time going ahead, we want to focus much more on this part. This is in line with an observation made by the Wellcome, who are funding actually many of these networks that are collaborating on this webinar series, saying that that although there are a lot of academic models being developed, there are very few robust, evidence-led, and operationalized models. So what we think is that there are like few rigorous assessments of prediction accuracy. This you can do through this platform, and it's all open source. So please contribute your opinions also on how we should best validate and evaluate models. Often the software is a bit reinvented ad hoc per project. We also, by meeting all of you together, we hope to kind of get everybody in the community around like a bit more of a standardized way of having standardized data sets. These train and predict and the file format and all of this, we want to have more standardized so that we can have more interoperability and run models side by side. And also we want to have this going through many iterations so that like disease programs and modelers are collaborating together. And we want to inspire this from this DHIS2 system and the HISP network that I mentioned, where what was learned in this project was that a health management information system needs to be different in and highly tailored to each country and each context, but there are not resources to develop it still from scratch in each place. So what you need is a long-lived reused generic platform. So this DHIS2 system has lived now for 30 years. We also hope that the CHAP platform we are using here will be up and running for decades to come, so that we can have interoperability and rigor, but also where innovations can flow back to the platform. And it's important to consider this socio-technical perspective. So what we hope is that to move from a situation where like there's a lot of modelers developing different things for different countries to having like a global pool of models that you as a community and we all together develop that can then again be tailored and evaluated for different countries. So that countries have many models at their fingertips. And ideally, it should be different components here, and we will come back to this in later webinars. So for that, we are trying to setting this up in an open community. We'll go more into this, where all of you can develop models like I showed now, share it with each other, share it with ministries, so that we work together as a big community. We have then custom models where you can make these linear regression, random forest, and more sophisticated models. And also the way to evaluate and show plots is now fully customizable so that everybody can contribute their own preferred solution for this back to one big platform where it all comes together. And this webinar series will now continue, as I've mentioned a bit, with an introduction to code bases. Let me just try. We will continue with going much more into detail and helping you all, because all of you should be able to do this, that I showed a glimpse of, to help you all get started with good technologies for working with code bases, showing you how to have version control, and connecting you also to some mentors and community of practice where you can discuss this, so that everybody can have like this working with a modern way of working with data science, which is like with GitHub, virtual environments, installation, and so on. Then we'll introduce this CHAP modeling platform, showing you how you can do the input data, the model training, the disease forecasting in much more detail. Then we will go into climate factors, climate change, and the health impacts, a full hour instead of my 5 to 10 minutes, about the data that is available, the fundamentals of statistical modeling. Then we will go into the climate data tools, how to get the data sets together, and also some harmonization strategies to get it aligned if you need more data sources than what we have. So please sign up for that. And some of you here have also been specifically invited to a physical workshop in Kigali in end of February, where we'll continue even more in depth on the topics that we cover in this webinar series, where we'll also have more of a hackathon aspect and go into use cases. This webinar series is an obligatory preparation if you're going to this physical workshop, because we want everyone to kind of be able to kind of start the hackathon from day one. If you have any questions or any practicalities, please discuss with the network contact that you have been in contact with. And if you're here at the webinar, haven't seen it announced broadly, and believe that there's a good reason why you could be it could be good for you to be at this physical workshop, please reach out. We will do a screening and see what we have capacity for, especially if you have self-financing to cover everything. There could be an opportunity for that. But it's important for us that you have then a good use case and that you have like the suited background for it. But please reach out if you're interested. I think with that, I'll just take the last 5 minutes to look through the chat. Woo! We will also come back to you. We will follow this up at the community of practice. So we will go through this. We will store all of that. And we also hope that you will use our community of practice in discussing that. I also see a hand. I'll see if I can give you the word. I will just briefly show that one place where you can discuss that is that we have, if you go to chap.dhs2.org, we have a community Get Connected, where you have this CHAP community of practice, which we are just starting now. And we really hope that you post things there. This is our preferred way of communicating, because then any question you have, you can discuss it with many in the community, and we can discuss it with many of you. We can take actually a question maybe. if I'm able to give you the word, or if Simona or something is able to give you the word to Mushaba.
I think everyone should be able to unmute now.
Yeah, please
Yeah.
unmute Mushaba or Brian.
Well, thank you so much. This is Brian from Uganda.
Hello, nice to meet you.
Nice to meet you now. Uh, I wanted you to direct me clearly because I'm very good at R. I don't normally use Python. I don't know if you promised to share the code or something. I want to practice how to do the climate infectious disease modeling that you are showing, but I particularly want to do it in R. And if I'm going to come to Kigali, because Kigali is just a stone throw away from here, you can share the details of how we can get in touch and how to arrange if I'm supposed to travel to Kigali. Thank you so much.
Thank you. Very
Who
nice.
do I get in touch with? Maybe you
Yes.
can share the email.
Yes. So I think the best is to contact us here at CHAP DHS2 and say a bit about like yourself and your setting, and then especially if you are self-financing, we can do a screening and we can discuss with you on how to do it. So we have a bit of limited seats, around 50 seats. But we are very happy to meet new people and discuss and see what we will be able to do. And especially when it's a close travel, that can make sense. As for the other question, if you go to this again and say, modelers get started. So this is CHAP DHS2, get started as a modeler, or for model developers. You can select whether you're experienced or want to kind of learn modeling. If you want to learn it, uh, we can follow this and you get to this guide that I showed where we have all the background, and then you can have your first model where you can click on the R and then you get the corresponding version of it here with the similar things that I showed, but now in R. And then we go a bit into the evaluation, point you to some literature to read. And then we continue with like how to make the models better by having multiple regions, again with R or Python examples, how to like look at historic data and exploit that again with Python or R example. So we will go back to all of that later. And we will have much more detail about this in the coming webinar series. I now just wanted to give everybody as a very brief overview of the whole thing from A to Z about like what is climate health, what is spatial temporal modeling, um, how can you yourself in the webinar series learn to install everything you need on your laptop, get started. Um, how can you now easily integrate it as part of this big platform where you can share your innovations with others and where you can have it rigorously evaluated and have it run on real cases. And I think in the interest of time, because we are now at 12:01, I think what we will do is that we will look through all of this. We will store all the discussions that have been here in the chat, and we will start a discussion on the community of practice around this. And I hope to meet many of you in the next webinar series, which will be even more hands-on and more concrete on January the 7th. Thanks to everyone joining.